Hi everyone, I'm Dr. Roman, and I want to welcome you back to my series titled Encouraging Cases, where I present to you a medical case of a patient who's doing well despite their diagnosis of cancer. Now, this is encouraging case number 5 of a patient with or who had a diagnosis of pancreas cancer. This one is different than encouraging case number 1, who was also a fascinating case of a patient with a diagnosis of cancer of the pancreas. Now, I do want you to know that I asked this patient for permission, as I do with all these cases, and the patient told me, quote, if my medical case will provide care or comfort to anybody, then by all means, please present it. So I want to thank her for that. And of course, we will be keeping all personal or identifiable information completely anonymous. So the reason for this series, as I've said on other videos, is when a patient is diagnosed with cancer, we all hear about these cases, and we all hear, unfortunately, about the bad news, how patients do poorly. But we usually, or seldom do we hear about patients who do well. And that's the reason for this case and, of course, this series. So without further ado, let's get into this case. Now, this is a patient, and I'm going to be looking down at my little sheet here so I make sure I give you all the information. This is a patient who presented in her early 70s, and she was having some weight loss, a little bit of pain, but really what prompted her to seek medical attention was her eyes and her skin were becoming a little bit yellow. And that's an important sign. So she presented to her primary care doctor. They also did some blood work, and this revealed that her bilirubin was elevated. So of course, the primary care sent her for a CT scan of the abdomen and pelvis with IV contrast, and this revealed a mass in the head of the pancreas. This was also causing some dilation of her common bile duct, and that's the reason she was becoming yellow. So at that time, the patient was referred to me. And of course, I sent the patient to the gastroenterologist for 2 reasons. Number 1, she was yellow, so I wanted to see if they could put maybe a stent in the biliary system so we can drain the bile, because since this mass was obstructing the common bile duct, that's the reason the patient was yellow and was also having some itchiness, because this bile can make you a little bit itchy. So a stent was put in, and it quickly brought down bilirubin levels. And at the same time, the patient had an endoscopic ultrasound. They did a fine needle aspiration of the pancreas mass, and unfortunately for her, she was diagnosed with having pancreas cancer, and it was an adenocarcinoma. So at this time, her CA19-9 surprisingly was normal, but her CEA was slightly elevated at around 7. So at this time, I referred the patient for surgery, and the patient underwent a Whipple procedure. And this was an open Whipple procedure. So the patient did quite well. She did have some issues with digestion, and it took her a little while to get back on her feet. But all in all, for a person her age, she did surprisingly well. So she was diagnosed with a pathologic T2N0 with 0 of 27 lymph nodes involved, and her margins were negative. So overall, her stage was a stage 1B. So the pathology did come back confirming an adenocarcinoma, which was the same histology that was found under the FNA that was done during the endoscopic ultrasound. And she was also found to have, on that pathological specimen, evidence of chronic pancreatitis, which the patient stated that prior to all this, she was completely asymptomatic. So go figure, she did have some evidence of chronic pancreatitis. So after this, as I stated, the patient did well, and I offered, all options of therapy at this time. We always have the discussion of chemotherapy, whatever possible treatment options we can offer. I also did genetic testing on her, and the patient told me, quote, "Doctor, I'm a religious person. God is going to take care of me. I do not want any further therapy. I want you to leave me alone." So she understood the risks. She understood that this cancer could come back. So of course, I'm going to respect her wishes, and I left her alone. After this, she started to gain weight from, as she recovered from her Whipple procedure. And the reason I'm presenting this case to you today is that despite having a pancreas cancer diagnosis, the patient to this day, and we are now in December of 2024, the patient is doing great. Her scans remain negative. Her tumor markers, including CEA, are normal. And the reason I think this is a pretty good case is because this all started, okay? You're asking yourself, okay, so how long has she had this? Well, when her pancreas cancer was first diagnosed was in June of 2022. So there you go. Even though this is an earlier stage pancreas cancer, we all know that pancreas cancer is very aggressive. And I've had patients that despite having a pretty early pancreas cancer diagnosis, they always tell me, you know what, this is a death sentence, because that is the perception out in the community. And overall, I don't want to mislead you. Pancreas cancer is a devastating diagnosis, as most of us already know. But in my opinion, this encouraging case number 5, as well as encouraging case number 1, is evidence that it is not always a death sentence. And the striking thing to me, or the reason I think this patient has done quite well, is she was so positive. She told me, you know what, doc? God is going to take care of me. And I usually do not bring religion into these things, but I have to tell you, her positivity, in my opinion, has helped her. So there you go. I've presented thus far 2 cases of pancreas cancer that are known to be, it's known to be a very aggressive cancer. And both of these patients are doing very, very well. So I do hope that this case provides you some hope, some encouragement. And there you go. I'll see you on the next encouraging case video. All the best to you.